My name's Gershon Kitsi and you are watching Melo TV. Now, February is Pregnancy Awareness Month and we chatted to two of our doctors. One is a pediatrician and the other is an obstetrician and gynecologist. And they've got sound advice, especially if you are planning your family or you are expecting your first bundle of joy.
As an obstetrician and gynecologist, so my role during the pregnancy is quite big. It starts off from the minute that you diagnose the pregnancy, the journey that you take with the parents, explaining of the necessities of doing certain tests, like I said, and scans for the pregnancy. You reassure parents over and over again. You bring a smile to the expectant parents. You walk along the journey with them during the pregnancy, and you showing them how the baby grows in utero, what changes are there in utero, and explaining things how the baby relates to the parents, how the parents must relate to the baby while still in utero is very important. The milestones of the baby while the baby is still in utero is very important. And the other factor is that as an obstetrician, I'm your gateway into having a healthy baby during the delivery. Besides going through the pregnancy, there is also the delivery stage. That's where it's very important that before we get to the delivery, you explain to the parents, this is how the delivery goes. Whether it's vaginal or whether it's cesarean section, these are the most possible things that can occur. I will be there for your delivery, and this is my role as an obstetrician to deliver your baby and make sure we have a successful delivery and you have a baby that you can hold in your hands and you are happy. And as an obstetrician, our role is not just diagnosing pregnancy and seeing patients in and out of our consultation. It becomes more of a relationship with your patients that you need to sustain even post-delivery. For their next pregnancy, yes, of course, you go through the same thing.
Hi, my name is Zandile Isaac, and I just had a beautiful baby girl 3 weeks ago at Melomed Hospitals. My gynecologist was Dr. Tisane, and she was amazing. The visits with her and everything was just, all the information was up to date, everything was good, and I was happy with her. The maternity unit, the staff and everything, they were great. They kept me up to date with the baby. When the baby was not well, when the baby was doing great. So I had a baby girl and I named her Livumile, which means that my ancestors have answered. So I've got 2 boys and 2 girls, so my prayers have been answered. And Melomed Hospitals is just great. The staff, everyone treats you like family. You would say that you're not at a hospital. I didn't feel like I was at a hospital. I felt like I was at home. I was taken care of from the minute I walked into the door, and from the second that I left. I was happy with everything.
So we have especially with pre-birth, we have a very good relationship with the gynaes. As you'll know, like having had a child yourself, there's lots of scans and checkups before you have your baby, which is done from the gynecological perspective. And then when baby is born, there's almost a handover where the gynae will tell you, look, there's this small issue that we picked up on the scans and baby's going to be born today. Will you take over the care after birth? And so we are kind of involved right from the start, before the baby's born, but we only get to actually look after these little people once they arrive in the world. Pediatrics can't function sort of in one isolated sphere of just looking at the child. It's also about the whole family, and it's about the mom, and a mom is never going to sort of, a child's not going to do well if a mom's not coping. And so part of our role is also to make sure that the mom is doing well post-pregnancy and make sure that she's sort of placed in the correct pathway should things not be going according to plan. So it is extremely sort of holistic. It looks at both mom, dad, the other kids, and how everyone functions together as a unit.
My advice for those planning to conceive, I still go back. Do a pre-conceptual counseling and consultation. Bring along your questions, write them in your diary, bring them during the consultation, and we discuss those things. We discuss your lifestyle habits, stop smoking, stop alcohol, healthy diet, multivitamin supplementation, and monitoring your menstrual cycle so that you know when are you menstruating, when are you ovulating, when is the highest chances of conceiving. And once that is done, obviously it's a journey that the physiology will just do its work over a period of time. And as soon as you discover that you have conceived, do an early appointment. Usually we say anytime from 7 weeks going on. The reason we say do an early appointment obviously is to confirm the pregnancy, how many weeks you are, and then also to make sure that the baby is in the uterus so that we exclude things like an ectopic pregnancy, which is a complication of pregnancy as well. So those are the most important things, I think. When you are just about to start a pregnancy, you need to make sure that you sort them out. And obviously the other things is to make sure that you find yourself a healthcare center that is equipped and you are comfortable with the doctor that is going to be looking after you, so that when you've got questions and concerns, you can be able to raise them on an open table and be satisfied with the pregnancy, because you want to have a wonderful journey with your partner, experiencing the pregnancy in a comfortable environment.
Thank you so much to Dr. Machidisho Tisane and Dr. Mandy Lynn Meyer for sharing their advice regarding pregnancy and women's health. Now, if you are expecting a baby or you're going to have delivery at Melomed Hospitals, we also offer the Melodine service. It's a 5-star meal for you and your partner just before you go home. Now, don't forget, if you'd like to be part of our free pregnancy workshop, it takes place on the 24th of February, and you have to RSVP as spaces are limited. Now, we look forward to welcoming you to the Melomed family, and we look forward to seeing you at our free pregnancy workshop. From all of us at Melomed, as always, take care of yourself and take care of your loved ones. Until next time, goodbye.